things. So I think the way that we are going to pursue this tonight is that we are going to start out with bone, and then I believe we'll go through either muscle or joint, and we'll end up with nerves because of the fact. Hello, Australia. Hello, Los Angeles. Hello, Bronx. Okay, so let's get moving. Let's get right to it. I think you'll enjoy this. Actually, I enjoy this. This kind of gives me a good old background because sometimes we get thrown off. We always seem to talk about nerve problems, pinched nerve, disc problems. So we're going to kind of tie all this in together. If we look here, the bones of the body, we can see that we have many. And anywhere from the cranium to the skull, down to the vertebrae, to the neck, mid-back, low back, to the shoulders, to the ribs, to the pelvis, as well as the femur, the thigh bone, the tibia fibula, and as well as the metatarsals, as well as the phalanges. Hello, India. So as you see that right there, obviously, this is pretty common right here. If you look at this x-ray right here, I'm sure you don't have to be a doctor to figure this one out. It doesn't look right in that tibia. This is a tibial fracture. Well, tibial fractures, like any bone condition, is going to take approximately 4 to 6 weeks to heal and repair. So the pain that you'll feel in a bone is primarily a deep throbbing. It's going to be a deep-seated bone kind of pain. It's going to be different. It's not going to be like a sharp pain. It's going to be a dull pain. It's going to be an aching pain. It's going to be real deep. The reason why I mention this, and this is not near as common, here's another fracture. You look from the other side here. When this starts to heal, you have what they call osteoblasts. Osteoblasts actually form and bring everything and mend everything together. Osteoclasts kind of eat things away. Now, the only reason why I wanted to bring this up when we look at the bone is that from a neoplasm, from a tumor, from something growing in there, even if it's benign and there is something going on in the bone, if you are experiencing any significant pain in a joint, in a bone, and let's say it's not in a joint, okay, like it's in the thigh or in the arm, and it's staying in one area, and even though you move or you don't move, the pain doesn't go away, that is something I want everyone out there, hello from Thailand, I want everyone out there to consult their doctor. Why? We want to be certain it's not a pathological problem. So from a trauma to a bone, to a contusion to a bone, to a fracture to a bone, yes, you're going to have throbbing. And even after a surgery to a bone, you're going to have pain because the bone needs to repair and heal. But if you're having pain in a bone and there's no etiology, no fracture, and that pain is the same if you're sleeping or getting up and it's not changing, I advise everyone out there to see their doctor. So that's primarily I want you to know about bone pain. Bone pain can be very, very painful. Cancer, metastatic, basically when the body is causing the bone to break down or deteriorate, and we'll go into a few other things in just a second, but bone pain can be very, very, very painful, particularly in the cancerous stage. All right, let's move on to the second thing, and I'm going to talk about the old muscle pain. Now, the old muscle pain, basically, the muscles can cramp. They can be deep. They can be similar to a bone, but obviously the muscle is going to be specifically in one particular area. If you pull your calf and you walk, that is the key. The key thing I'd like everyone to know about muscles is that muscles attach into bone. There is a muscle, a belly of a muscle like this, and you have a tendon off one side, and you have a tendon off another side. And so one side attaches to this bone, the other side attaches to that bone, and in the middle is the belly. Now he's holding the belly of his gastrocnemius or his calf muscle. So generally when you have a muscle problem and you utilize or put pressure on that muscle or you use the muscle because muscles are designed to move bones, if you move the muscle like you're walking or even, a problem in the face like you're talking or eating or chewing, or if you pull a muscle in the shoulder and you notice you can't lift because actively you're using the muscle and tendon, and if you hurt it, if you strained it, obviously a strain is dealing more with the muscle and the tendons, and a sprain is dealing with the ligaments. But muscles can be very painful. It will limit your range of motion. And generally, if you take, let's say you hurt your shoulder and you lift up and you can't and it hurts, then it's generally a muscle condition. Okay, now the way to know it's not a muscle condition is that let's say that someone lifts it for you and it still hurts. The muscle's not being affected and the ligaments being affected. So generally, whenever you hurt ligaments, you're always usually affecting muscles. But muscles are deep pain. Now, I don't know if people had Charlie horses before, magnesium deficiency, even calcium deficiency, overuse injuries, running too much, weightlifting, pushing too much weight, overworking the muscle fatigues, a buildup of lactic acid. Those are muscle pains. Now, those cramping pains are very, very painful, but it's a different kind of a pain because a muscle pain is usually always localized. It's always hurts when you're using the muscle. Generally, when you rest the muscle, you will not have that pain, generally. So I want you to know that when you contract the muscle, your brain is sending mental impulses, energy down the spine to that particular muscle, and that muscle's contracting. If that muscle does not contract, you're generally not going to have a lot of pain. A muscle pain is something that's localized. It can burn, okay? If you overuse it, it builds up in lactic acid. The muscle pain can be deep-seated. It can be cramping like a Charlie horse. And by the way, let me give you guys a little tip. If you're in bed or you have a Charlie horse, all right, and let's say it's your calf right here. I'm not going to stand up for you, but let's say it's your calf. And this is my toes right here. So what you don't want to do, okay, with the Charlie horse is point your toes out. Because if you point your toes out, you're stretching and you're contracting your calf. So what you want to do with the Charlie horse, you want to dorsiflex. You want to bring your toes up towards the ceiling. Okay? So if you bring your toes up, it relaxes the muscle and takes that cramp out most of the time. But if you're having continuous cramping, calcium deficiency, magnesium deficiency, electrolyte deficiency, if you're an athlete, you do a lot of running, you can be deficient or even dehydrated. Make sure that if you're having cramping, always hydrate. Very, very important. Okay? That's the muscle. Now, obviously, here's another important thing. People know this kind of stuff because they see over and over, they look at my channel, they see the problems with poor posture, forward head posture, rounded shoulders. Here, again, tight upper trapezius, levator scapula, inhibited rhomboids. The rhomboids are actually weak, which are between the shoulder blades, trying to keep those shoulders back. One of the most important things we could do is keep those rhomboids strong. Most important, tight pectoralis muscles. You need to stretch the chest muscles, get in the door, put your arms up like this on both sides inside the door, and stretch those pec muscles because those pec muscles are going to pronate your shoulders and bring your head forward, and those muscles are going to start to ache. Very important. Now here, this is a little complex, but I wanted to bring this up. I know it may be hard to read. You can go ahead and put this back. You can come back to this. This will be posted on my channel after, but this type of posture affects muscles inside of us. It affects other things as well. It affects our organs. It affects our discs. It affects many different things from poor posture because we're kind of crunching our organs together. And again, we're affecting the psoas muscles that affect our hip flexors, which can cause contraction. It can weaken the glute muscles. And from here, we can start straining the neck, straining the muscles, and start developing other symptoms as well. So you can come back this. Now, I didn't have enough time. I wanted to throw up another thing. I want to talk about the heart. The heart is a muscle. It's a smooth muscle. The stomach is a, basically smooth muscle. The intestines, like smooth muscle. If the muscles are not happy, they cramp. They cramp. If the heart is not getting its blood supply, it cramps, called a heart attack. It's not getting blood. If the stomach is not happy, it cramps. If the intestines are in spasm, it starts to cramp. Those muscles, those smooth muscles, which are not skeletal muscle, still cramps. Deep-rooted, very precise, uncomfortable. It's persistent pain, but the muscles usually do not radiate. Okay, the muscles do not radiate. The muscle is kind of deep-seated into one area until that muscle becomes happy. Remember, it's like you. If you're hungry, and I feed you, you may be having hunger pains, but if I feed you and the hunger pains start to go away, remember the muscles need its oxygen, it needs its proper magnesiums and proper electrolytes. If it's not getting its balanced potassium, magnesium, and its calcium, proper metabolism and electrolytes, it's going to contract, it's not going to be happy. So I want you to understand about muscles. That is something really important. Let's head for the second most common thing, the third most common thing, Actually, this is the second most common thing. We're kind of working backwards. We're talking about joint pain. Now, many of us have joint pain. We get older, what happens? I'm going to show you in a second. Joint pain, knee pain, shoulder pain, hip pain, disc pain, joint pain in the vertebrae, low back pain, ankle pain, hand pain, finger pain. These are all joints. Joints are made up of, they have synovial fluid in between the joint. There's articular cartilage. Let's come on over here. This is just showing us all the different joints, but we'll come back to that. Now look at this joint here. This is a normal joint. It has synovial fluid in the middle. The osteoarthritis, I wanted to give you the example of an osteoarthritic joint and a rheumatoid arthritis joint. These are the most common types of arthritis. The osteoarthritis joint is the wear and tear. Wear and tear means, like the vertebrae, when the vertebrae get closer together, as that disc wears out in the spine, the vertebrae get closer together and we start going through degeneration. We get spurs put in there. We start to lose the curve. The discs get thinner. The bones get closer together. We start affecting nerves, which we'll come back into a second. But I want you to understand the difference between osteoarthritis and rheumatoid arthritis. Osteoarthritis is a degenerative disease. Degeneration means extra weight, poor posture, forward head posture, old injuries, old falls, chronic or chronicity of a position that you never change. What happens is the joint starts to degenerate, starts to erode, the cartilage starts to thin, the bones start to come together as we start to wear out things. But osteoarthritis is usually unilaterally. Here's the key. Unilaterally means that it's usually one particular joint. You can have osteoarthritis of two joints, but it's usually one joint worse than the other. Rheumatoid arthritis is usually bilaterally. Rheumatoid arthritis is an autoimmune disease. Rh factor checked on your blood, but Rh factor will indicate that you are or potentially have rheumatoid arthritis, Rh factor in your bloodstream, which can make you prone. Basically what happens is the joint starts to swell. From the swelling, the body goes through different degradation. It starts to wear because of the inflammation. So the key thing is anytime we have joint pain, joints are localized, always hurts with movement. Joints usually always will become red. It will become inflamed. There will always be inflammation and always ice in the acute phase. Chronic phases, you can use moist heat. But joint pain is, again, very, very painful. Why? Because every time you use the joint, it hurts. Joints can throb, they can burn, they can radiate, they can travel because you have nerves going through it. But joint pain is something that, again, similar to the muscle, it's going to be localized, but it can refer to other areas. Sometimes you could have pain in the joint. You may feel the pain back on the neck referred because pain can radiate as there are trigger points that actually work hand in hand with this. But I want you to understand osteoarthritis is bone on bone. Rheumatoid arthritis is bone erosion. And when we burn out these bones, it's like burning out a tire. You have to be careful. You need to take care of yourself. My best advice for people with joint problems, we talked about bone. We talked about you talk about bone health, about bone soup, about mixing the bones with the chicken and make your bone broth. The bone broth is excellent. It has a glucosamine sulfate, it has a chondroitin, it has anti-inflammatories in there. It has your magnesiums, your calciums, your phosphorus. Very, very good for osteoarthritis. For any type of joint problem, bone broth is extremely good. A lot of people just killing those pills, taking all those pills. I always like to see, do it the natural way. You're going to get better effect, I think. But look at the normal joint. The most important thing is you need to maintain proper weight. If you're overweight, you're going to have degeneration. What happens is when you have degeneration in the knees, you become knock-kneed. The knees start to come together and you start to look knock-kneed. And you start having problems on the inside of the knee, which is a very common thing. If you look at this right here, we look at this joint problem. These joints right here, very common. Joints can develop other problems like gout, more common in the big toe. It can happen in any joint. But osteoarthritis is more common, particularly in heavy weight-bearing joints. So that means your hip is very prone to it. See the hip degeneration. Your feet are not as prone. Your hands are not as prone. Your elbows are not as prone. Your hips, your spine, and your knees are the most common areas of arthritic changes because of weight bearing. Okay, let's go to the last thing. And the last thing I saved the best for last. Typical sciatica. Wow. Pain going down the leg, buttocks pain, lower back pain, the sciatic nerve, fattest, longest nerve of the body, size of my thumb, goes down the back of the buttocks, down the leg, burning, tingling, numbness, cramping. Now, nerves are different than anything in the body, okay? Nerves travel, nerves radiate, nerves burn, nerves tingle. You can feel ants crawling on you. You can feel a radiation. You can feel a throbbing. You can feel a burning, a tingling. You can feel a numbness. You can feel a different sensation called paresthesia. Now that is the sciatic nerve, but this here shows us problems coming out of the neck. Thoracic outlet syndrome. This nerve comes from the brachial plexus out of the neck, makes its way into the shoulder, arm, down the hand of the fingers, tingling, numbness, cramping, burning, goes to the chest, goes inside the shoulder blades. Here is shown the scalenus muscles contracting on that nerve and being compressed, burning, pain. When you affect a nerve in one area, you can feel symptoms in another area. I want you to understand something. When you have sciatica going down the leg, you don't have to have low back pain. If you got burning or tingling or sensation going into the arm, you don't have to have neck pain. I want people to understand that. If you have TMJ, maybe pain radiating in the jaw, you may not have pain in the jaw. Nerves play funny games. You can have compression under the skull and have pain behind the eyes with no pain back here. So that's something I want you to understand. Here's neuropathy showing nerve cells. This is basically telling you that these nerve cells, okay, have myelin. And this myelin sheath actually protects the nerve cell. And as this myelin sheath doesn't work, you lose feeling, like peripheral neuropathy, diabetic neuropathy, because of this. And there's other diseases that can affect the myelin of the nerve roots because you have millions of these. This is what allows you to feel, allows nerves to transmit from the brain, down the spine, out the nerves to where they're functioning. Remember what we showed you before. We showed you before, if I can find it here, that the nervous system, well, maybe I can find it here, 1 second, controls everything. Your brain and spinal cord is your central nervous system. If you're new to this program, we talked about in a recent program of ours that the nerves, the brain and spinal cord control and regulate not only what you see here, they control the heart, the lungs, the liver, the gallbladder. They control the autonomic nervous system. They control the sympathetic, the parasympathetic nervous system. Okay? They control the fight or flight. They control the hormones. They control the endocrine system, the exocrine system. They control the kidneys, the heart, the cardiovascular. They control the intestinal system, the gastrointestinal. They control the sexual reproductive system. Every system working through you is working through this brain and spinal cord. So when there becomes irritation along these nerves don't function right, it can affect organs as well. I want everyone to know that. Go look back on our video, I think we did this recently. Go back on my channel on the nervous system. It shows you basically exactly what I just talked about and shows you all the pictures. You need to look at that. That will really educate you about your nervous system and how it's working. It's a great little program and it's pretty easy to understand. And finishing up very soon, here is carpal tunnel syndrome. Now, everyone has heard about carpal tunnel syndrome. Cumulative trauma disorder, typing, using our hands, knitting, mechanics, doing work, electrical work, fine computer work, fine detailed work. When you use your hands and your muscles repetitively, you can affect nerves, and those nerves can cause burning into the hand, tingling, cramping, numbness. So the nerves are going to cause those kind of symptoms, the tingling, the burning. Burning is common. Traveling, referred pain, paresthesia, abnormal sensation, pain. And obviously, nerves control those muscles. So if the muscles aren't happy, the muscles can cramp. So now we have a combination of cramping as well as nerve irritation. So you can have two different problems at the same time, but you need to address the causation. The causation would be compression on that median nerve. If you get rid of the causation of that median nerve, then the muscles are going to be happy. We talked about muscles getting its food, muscles getting its blood supply, the heart getting its blood supply, your brain getting its blood supply. Now, the brain is not a muscle, but a stroke is basically lack of blood to the brain. It's a little different, but the muscle to the heart is a lack of blood supply to the heart, is a heart attack. So that will show you the area of carpal tunnel. This here shows you again the nerves of the body. This here shows you the nervous system of the different nerves that we're talking about, the brain going down and what it controls through the peripheral nervous system. It controls, just showing you where the nerves go to, but those nerves also control the entire autonomic nervous system, which is your viscera, your heart, your lungs, and everything else. So I hope that you guys really enjoyed that. You know, this is really good stuff. And I ask all of you guys, if you have not subscribed, I ask you to do so. And I ask you to go back to my channel and go through a lot of those videos. The last couple of weeks, I've been spending a lot of time with nutrition, just recently with the nerve supply, the nervous system, how it works. I have over 1,000 videos up there, and I tell you, they're being hit by the thousands, the hundreds of thousands right now, because there's a lot of great self-help videos. If you just tuned in with me, check out the self-help videos with neck pain, forward head posture, pronated shoulders, things that you can do on your own. I mean, I like to spend a day right here putting up just what people have written me, not only on the internet, but sending me letters to my office and sending me letters to my mailbox. Just, it's the best feeling in the whole world that we're touching lives along the world, and we're helping people naturally. We're saving thousands of dollars out of their pocket, and we're educating them. We're teaching them. And this is why I ask you out there to spread these videos out, share them on your social media. You don't have to ask me, just share them on your social media. I can guarantee you're going to do a good thing for a lot of people. I put a lot of heart into this because I really love helping people. It's been my passion. And that's about it. I really hope you guys enjoyed this program. And this will be up on my channel in the next half hour. I'll come to the chat room and I'll answer any questions. I also want to mention on Facebook, Motivational Doc, as you see right there, Motivational Doc. On my Facebook is the best way to ask questions over there, leave messages. I can actually chat with you on there at times. But that is something that makes it much easier for me to communicate, because I get so many emails that I can't, impossible to get to. But anyways, guys, I thank all of you out there. A lot of respect for people out there across the world, as well as in the U.S. here, who attended this chat room at this time of the night. And I just want to say God bless to you, your loved ones, and your family. And I'll say it again, make it a great day. Good night now.